Welcome to Body Reconnect, where I help you to decipher the signs and signals your body sends you. Learn to listen to your body so that you can course correct, make changes in order to live your best healthy life. I'm certified wellness coach and lymphatic therapist, Michelle Dominique. I had a client contact me recently, and he had some questions about he's going through a series of medical issues, and he went to a specialist, and now he's going to another doctor for something else. He's already had testing, MRI, CAT scan, whatnot, but the new doctor has said, let's just do more tests. And he asked my opinion on, I don't know, should I really do that? Let me explain something to you. If you came to my office to schedule a lymphatic therapy session and I said, you know what, I'm only going to do lymphatic on one side of your body, or something just off the wall, would you not question me? Would you not say, I'm paying for this service. I want to do, this, or I want to do that. I mean, I just want to, you only need lymphatic on your pinky toe, or I don't know, something crazy like that. If it seems crazy and out of context in a general setting or another setting, it's crazy and out of context in that setting. I don't think, I've talked to this before. It takes a village to raise a kid is the old saying. You need a village. You need a wellness circle, right? Where you have different people maybe all plugged in. You have your Western medicine, traditional medicine, even pharmaceuticals. You also have on that wheel complementary medicines like lymphatic drainage, chiropractic, acupuncture. There should be a whole connection of people who are working for your best interest. So that being said, if you have two medical doctors, they're two medical doctors. When you go to the doctor's office now, they already include in the packet a form that says, who do you authorize, or do you authorize sending information to another medical professional? It's already in your HIPAA packet, right? So for another doctor to not call or get records or need, it hasn't even been a year, by the way. This is relative within the last 6 months, and they're asking for another. That's kind of sus to me, right? Because insurance fraud is real in medicine. Check Dr. Fayed, in Detroit. Yeah, he's not the only one, but it's a big deal, right? But the other thing is too, you are paying that doctor. Don't let the fact go that you are paying insurance premiums, right? I don't care if the insurance company is paying the bulk of the payment. You are still paying premiums. You are paying for the service. Speak up. I always tell people, if you are not one to really speak up for yourself, bring someone with you who can. I have gone, my patients have, I have gone to doctor's appointments. I really have. Like, hey, my appointment today is going to be, instead of us being in your room, you're coming to the doctor's office with me to ask the questions. If it's less than 6 months, what growth of anything, you don't even know if anything's there, but now, like, how much growth is going to happen in 6 months of something that's not there? Also, to confer with the other doctor. I have people who I confer with their doctor, and I'm not even a doctor. Start understanding that there's a relationship. It's a patient-physician relationship. Granted, your doctor has the information, knowledge, because he studied so much. But, sometimes just applying practical common sense is very important. Now, here's why I say this. I'm going to let you do this research because I don't, sometimes it can be scary and I don't want to promote fear. There was a time when I would say, hey, look, these are the risks. I'm going to tell you, I'm going to suggest you Google some of the side effects or negative reactions of having frequent scans, particularly CT scans. I don't care what the technician says who performs the MRI, and I know because I asked this question on purpose. The one time I had to have one and was told, oh no, the contrast dye that they put in your arm, you're just going to pee that right out. You will not. You have to be very aggressive, or else it's just gonna, over years and decades, maybe come out. You have to be very aggressive to remove that stuff from your body. Why is this important? If you are a compromised person, you are having a raging autoimmune, you are dealing with cancer, MS, one of those things, you need to know this stuff. Don't just keep going in, I got to get a test. That stuff is not as benign as you might think. I know this for a fact. I've worked in holistic medicine for about 10 to 2 decades now. And in one office that I worked, which was a medical doctor's office who also did alternative medicines, at least one of my clients, I know 3 for sure, but this was not uncommon, where they would go, for example, I had a client who they told her, you have cancer, you have a heart issue, so we're not going to do chemo. So we're not going to do chemo because you have a heart issue, right? So when she came, she was nervous or whatnot. And anyway, she stayed the course. She started applying the alternative techniques. We were doing lymphatic a couple of times a week. She had an amazing quality of life, The disease was still there, but she didn't have the side effects from chemo or, so she was doing great. Still had the cancer, but she was living a life. You know what I mean? Then she went to another doctor or something for something, kidneys, and the doctor wanted to put a stent in, but he wanted to do tests. So they put her under anesthesia. She had a heart condition, remember? That's why they didn't do the chemo, because they didn't think her heart would take it. So I give that example because if testing was that benign, why is it that within 3 months, I knew when she came back on a Monday, was like, what happened to you? And she said, I went to and he said, let's just see. That was what it was. It wasn't even, she was just living what was left of her life and living it well. But those words, let's just see. In 3 months, it just progressively went downhill. Stop thinking. I tell you all the time, I tell my clients, just because the doctor says something is routine procedure, routine test, all that means, here's the interpretation. The interpretation is, I've done this a lot of times in my 30 years in medicine. That does not speak to how your body will handle it. Start being an advocate for yourself. I don't care who it is. Start being an advocate for yourself. Ask questions. Like, call the other doctor for the test I've already taken. And hey, do yourself a favor. Look that up. the adverse effects of CT scans, the radiation from taking a CT scan, and let's talk about contrast dye and MRIs. The more you know, the better you can advocate for yourself. If you have any pressing questions, please DM me. Your first consultation is absolutely free. I would love to talk with you. It is my privilege. And it really validates what I went through medically myself, what I went through medically with my parents, the knowledge I learned that I didn't want to learn, but having to go through this helped me to learn to be able to help you. So I look forward to helping you live your best, healthiest life. But you got to call me first. You got to reach out first. Be sure to share and like this video, and I'll see you on the next video.